Time now for this week's Health Matters. Paul Critz with you, along with physician assistant Lynn Szabo. And this is an interesting topic today, Lynn. For my first question is, did you have to take the Hippocratic Oath?
No, I did not. I'm a PA.
Okay, you get out of
NPs, PAs, RNs. This is only for physicians.
Okay. Is there anything analogous for RNs, PAs, and such?
No, not at all.
Okay.
Physicians are the only people that have to take it. But it was hypothetically invented by a guy named Hippocrates in early Greek. And so my profession doesn't go back that far. But or RNs or NPs, actually. So I brought in a gift that a patient gave. I have a patient who was originally a Greek citizen, immigrated to the United States, and he brought in a little bust of Hippocrates. Now, we have no idea what the guy looked like, right? This is artistic license. But
I know a guy looks like this, actually.
I know. He's kind of generic guy.
Yeah.
But it's too bad. It's too bad this is radio, because he's got a purple ribbon, which I think signifies like Prostate Cancer Awareness Day, and then also a bead necklace. So he's definitely Humboldt County.
Were you added these to the bust? Is that what this was? Okay.
Yeah. So anyway, Hippocrates. So this is the Hippocratic Oath. Mm-hmm. I think it should be more widely understood, and for some good reasons we'll talk about later.
It's one of those things that like everybody seems to think they know about, like Miranda rights, and you know, but really when you start asking questions, you don't.
Really,
Yeah.
It's not what you think it is. So it's a code of ethics taken by new physicians to swear to the healing gods, and they're the Greek gods, okay? So Apollo, Hygienia, and Panacea, and then there were about 15 others, and I couldn't really pronounce
Right.
more than those top three. But and it happens when a medical student, there's like a magic day, I think it's June 30th, actually, and where June 30th, they wake up as medical students, and then they go through whatever day they have. They have a special ceremony that evening in front of the dean and everybody else. And the dean of medicine is usually like scary important. And then they take their oath, and they are physicians.
Wow.
And it blows all their minds, because they're still signing their charts, M student 4 and stuff like MS4. And the nurses have to remind them on July 1st that they're doctors. So they kind of like, they go from all these experienced interns who are first year MDs, then on June 30th, and then the next day, July 1st, all the medical students advance 1 year, become physicians, and let's just say don't get sick that day. Yeah. So, because it's like more than they can handle. It's a really stressful day.
Wow. So, I mean, it changes that drastically for you? I mean,
Yeah.
So are you technically then a resident, or do you have to find a residency someplace?
No, you're technically an intern.
Okay.
And then, so all the interns that were interns on June 30th all become residents, first year residents. I mean, it's a system-wide, like cataclysmic event.
Like changing the hours, like changing like spring forward, fall
yeah,
back.
only it's scary. So, and
Wow.
Yeah, it's kind of interesting. That's why I always get a flush of new doctors here in town at the end of the summer.
Right.
Okay, because they graduate June 30th from their programs completely. And then they usually go to lay on a beach for a month or two, and then they start in practice.
Wow. So is part of that ceremony, that crossing the bar, that magic moment, is the Hippocratic Oath part of that?
Yeah.
Okay.
It's a super important part. So it's the earliest expression of healing ethics. Okay. And it might not actually be written by Hippocrates. We don't really know that. And it certainly has been modified, and there's a push to personalize it, kind of like personalized wedding vows.
Well, wow, really? Seriously?
Yeah.
Like, okay. So we don't know whether or not, do we know whether or not Hippocrates was an actual historical figure?
Some people would argue no.
Okay.
Most people would argue yes. So it's the first writings that established the importance of medical confidentiality, which I think is important, and of non-malfeasance. So non-malfeasance starts with the phrase, first do no harm. Okay, that's the part that we all kind of remember from it.
It's non-maleficence.
Okay, thanks.
Like, so I just wanted, because malfeasance means
different.
is money.
Okay.
Yeah, but
Good.
and I was reading through. I was having to sound like a Greek god's name. I'm having to sound maleficence. Okay, maleficence.
Well,
Okay.
okay, thanks for the correction. It's mostly of symbolic value, but it is the foundation of multiple legal statutes and can carry criminal or other legal liabilities.
Okay.
And you'll commonly hear it. So after all the patients go home and the medical assistants are gone and the lab's closed up, doctors used to sit around and talk about cases. And it was an informal learning situation. And you would often present a conundrum, like, should I do this or should I do this? And it almost always that conversation resolves, well, first do no harm.
Okay.
So it's super important to him.
That's interesting. That's an interesting sort of thing, that kind of
Yeah, and
shop
they
talk.
kind of got away with it away from it after electronic medical records, because everybody just wants to leave at 4:30.
Kind of got away from what?
From the sitting around and talking.
Oh, okay.
We used to chart by hand on paper charts around a big dinner table, looking like a formal dining room table. So maybe 6 doctors and assorted PAs and NPs.
Wow.
And immersed in the love of medicine. It used to be a lot funner.
And that's interesting that the advance of technology is, I guess it's not surprising, but it is interesting that the advance of technology is kind of hampering and hindering actual exchange of knowledge, kind of free flow of knowledge.
That was actually the way that Hippocrates was thought to teach medicine.
That Socratic method.
That Socratic method, yeah.
And again, it's Hippocrates, from what I've read, I did a little homework and just went and read the Wikipedia page. But it comes from that golden age of Athens, that like 5th to 3rd century BCE, and that's all Plato and right up Toe and Aristotle, but Plato and Socrates and all of that prime time.
Yeah. Did you notice also that it kind of has embodied in it a respect for one's medical teachers?
Oh, right off the jump, yeah.
And then a responsibility to teach one's, students.
I thought it was also funny that the first line, at least in the version of the oath that I read, the oldest version, also had, you've got to share your money and support your teacher too.
Right.
We're all in this together.
It's totally not what happens now. So not likely written by Hippocrates himself, although who really knows? And it was initially written in Greek, so that brings up the point of translation bias. So a lot of interpretation bias, and it is not something PAs, RNs, or NPs swear by, only relevant to physicians, like we said. And it's not likely well understood by the person in the exam room who's frustrated at not getting something that they need from the physician.
Can you give me a for instance with that situation?
It's usually a particular group of medications, and then it's, if you believed your oath, and it gets said to me a lot. Okay, I wasn't involved in this oath, so, but I, it's usually used as a guilt maneuver to try and get the provider to give somebody something that is actually going to do harm to them. So it's always like a razor's edge. Are you doing harm? Or are you not doing harm? And it also implies a responsibility to know what is harm and what isn't harm. So it implies a responsibility that you have to keep up on the science of medicine and be able to talk about up to the minute what is the most appropriate understanding of medicine and how that's going to apply to the patient.
Wow.
So the responsibility is not what people think. It's not, they don't take this oath in order to somehow be good guys and always do what patients want. They have a huge responsibility to do what is right. And it's not only by their judgment, it's also by up to the minute science.
Wow.
Which becomes, I think, relevant in COVID. Because so many physicians and medical people in general were, not trusted.
So are you saying that like, say, ignorance of the most relevant and up-to-date science, or even just ignorance in general, is that a way that a doctor can find themselves in a situation in which they're not living up to the oath?
Yeah.
Yeah.
Because the oath itself requires you to be, scientifically aware up to the minute.
So at what point does a doctor's own volition not come into play or not? I guess when you make a mistake,
right,
you've done some harm. I guess it's the intention is what you didn't have the intention to do the harm. You might not have the intention to not be up to date on everything. You just may not have simply known something. It just seems like that's a big wide gray area in which a doctor, it's like a tricky place for a doctor to be, for a physician to be, because you just might not know something, and then that could result in
enormous responsibility.
Yeah.
So that's what I would say is, by us sitting around after the end of the day and discussing stuff, I mean, people who love medicine are going, I just read this paper, you got to see this paper. Or, I think they used to look at it that way, but the newer data suggests it's this way. Right. And that doesn't really happen anymore. It's super sad. But I think that was kind of an expression of the Hippocratic Oath and the responsibility they have.
Right.
Yeah, super important. So let me kind of go down here. So if you were a fly on the wall, you would totally hear this, okay? But this is a living oath, all right? This oath was changed in the 17th century. This oath depends on what science is telling us at the moment. This oath depends on the situation. This oath depends on the best judgment of the physician. So it's living, and it's changed frequently since the initial author, and it continues to change. So right now, medical students are asked to personalize their oaths, because there's a section in it, for example, that is anti-choice.
Oh, right. So, but which oath are we talking about?
We're talking about, that's a good question.
Right, because
which one are we talking about? What's presented as the original one, which is an original translation from Greek, has some parts in it that don't really fly well in present day society.
Right. There's specifically
reproductive justice is specifically quashed.
Right.
Yeah.
So the translation I have is similarly, I will not give to a woman a pessary. I don't know what that phrase means.
It's just something that goes in the vagina.
Oh gosh, okay.
It can be a lot
to
of
cause
things.
abortion.
Right.
Yeah.
Right.
That's an interesting thing. What I've noticed too is, and I don't know if when did that drop out?
It hasn't really, but that's so a lot of new physicians can't swear to that, because they don't believe that that's ethical. And so what's happening now is there's kind of a push to write more personalized vows, and not only for reproductive justice, but also for racial bias, recognizing racial bias and, addressing that. And, it can go in a lot of different directions as you modernize your interpretation of it.
Wow.
Yeah.
So I'm looking at, I was looking at one of the revisions, I guess in the 60s, it was updated.
Yeah, 64.
Is his name really Louis Lasagna?
Probably.
Sorry, it's a great name.
It's Dr. Lasagna.
Dr. Lasagna.
It's Dr. Lasagna to you.
Anyway, is this the most common form in the United States of the Hippocratic Oath that's administered now? Do you know Louis Lasagna's version?
They're asking a lot of the students to rewrite their own versions now.
Wow.
So I don't think there is a single common version.
Okay.
And I think it kind of depends on, the program you graduate from, the kind of medicine you're interested in, what you see yourself doing. Because this would be different, say, for somebody in research as opposed to somebody in pathology, as opposed to somebody in women's health.
Wow. Wow. Okay.
So.
And there are other oaths too. Right? I mean, so I'm just reading in here. I've got, in a 2000 survey of U.S. medical schools, all of the then extant medical schools administered some type of professional oath.
Right.
Among schools of modern medicine, 62 of the 122 use the Hippocratic Oath or a modified version of it. The other 60 schools use the original or modified Declaration of Geneva, the Oath of Maimonides, or an oath authored by students and or faculty. All 19 osteopathic schools use the osteopathic oath.
Right.
Wow.
So my point exactly, it's kind of super variable right now, depending on the situation. And there's concern that this dilutes the central meaning of the oath. I mean, that you can kind of pick and choose, what you're going to, quote unquote, be ethical about. But younger physicians, and I agree, feel that making the oath more personally significant is kind of the way to go in their medical lives. But
that undercuts the kind of standardized adherence to an ethical.
Yeah, you could
framework.
argue it dilutes the whole purpose. Totally, absolutely.
Where do you stand on this?
Where do I stand on this? I like the diversity in the application to modern times and modern situations, especially with reproductive justice and racial biases. But I think it should be expanded. So it should be a PAN-PRN thing. And I think the RNs have their own special one, actually, that is kind of secret to me. But I would say that there needs to be an oath for somebody who is a hospital administrator to be ethical, somebody who is an insurance CEO to be ethical. You see what I'm getting at?
I do, but then that begs the next level of questioning is then where do you find those ethics? Who decides what those ethics are?
Right.
I mean, it's one thing to say you must be ethical, but then you have to define.
Right. There also is no clear-cut moment where somebody graduates from college and becomes a hospital administrator, which is
Maybe
kind of the other
be.
problem. But I think maybe if you go to work in as a top administrator in XYZ insurance company, I think you have a personal responsibility to make ethical decisions, and they're so not happening. So I think it could be expanded, and the devil, of course, is in the details. But why don't we have something like this? For maybe lawmakers who are writing law specifically to do with medical care.
I guess I'm afraid that in a lot of ways, expanding, dealing with things like this, with frameworks like this, we'll end up arguing about this and not about things that really need to happen. First off, I've got
like it's a diversion
from Louis Lasagna's. I'm going to say this every chance I can.
He's going to haunt you,
Dr. Lasagna. This is from his rewriting from 1964 of the Hippocratic Oath. I will prevent disease whenever I can, for prevention is preferable to cure.
Yeah.
Okay.
That's amazing.
So what does that mean for anybody's ethical responsibility? Let's say if we're talking about healthcare outcomes, if we start talking about poverty in America, if we start talking about all of the other things that contribute to health that aren't just hermetically sealed inside healthcare.
Right.
Then would a doctor or anybody administer this oath then have some sort of subsequent responsibility to think of health along those lines as preventing disease?
I think some of the newer graduates in certain programs would say yes. Absolutely,
yeah,
yes.
I think you're right. Yeah.
Absolutely, yes. And I think the business and law part of it should also have a responsibility. And you could argue research people have responsibilities, to have, not come to conclusions based solely, on their biases, but to try to prove themselves wrong and try and have clean-cut experiments with clean-cut data. I mean, yeah, I think it could be in a lot of different directions, but we don't even have any of that.
None of it, yeah.
And I think it's a problem because I think insurance company CEOs are some of the highest paid people in the United States, and they get there mostly by saying no.
Right.
So that's not ethical, in my opinion.
Yeah. But again, defining that
how are you going to hold them to it too?
That ethical framework. I mean, if we're talking about it in terms of, I might be an insurance person, an insurance executive, but I'm not a healthcare provider. I'm not a physician.
Right, they dive into that constantly.
Sure.
And then they want to have a medical conversation with you, and then they say...
Until it starts redounding onto them, and then it's like, oh no, let's be capitalists now.
No, we're not doing the MRI.
Yeah. yeah. So I think you're right. I mean, yeah, it's like, I guess if we had some sort of overarching
It'd have to be super general, though.
It would have to be super general.
Right. But maybe it'd have to be looked at like every 5 years to see how to change over time.
And again, the more general it is, the more open it would be to people arguing about the oath and not so much about arguing about something that's happening in the world, really.
Right.
So I don't...
And then how do you hold people to it? I mean, doctors are very proud of their Hippocratic Oath. And in that moment when they're in front of God and the dean and everybody is usually the phrase that's always used is that they like got little tears in their eyes, and that was a super important developmental thing. So if we could get other people in medicine to want to follow an ethical path as much as that habit is meaningful as it is to the physicians. I think that would be amazing.
I think it is when so much of what can determine your outcome, your health outcomes, is tied to money and things that are outside of just health.
Right.
That, yeah, if we folded those other aspects, okay. So I'm seeing like, all right. So if we do create some sort of Hippocratic framework that brings in all of these other people who are outside or only 1 foot in healthcare or 1 foot in the ethical side of healthcare, people like the insurance, and administrators, things like that. If you open up the Hippocratic framework to include them, are you just institutionalizing the healthcare system as it exists now?
Not if you reevaluate every X years or something.
Okay.
No, I don't think so. Because you're saying, are you just trying to make...
Are you inviting insurance executives into the healthcare profession by allowing them to swear to the Hippocratic Oath if it was expanded that way?
Yeah,
and so solidifying
they're already in the healthcare profession.
Exactly.
They say they aren't, but they are.
And I'm saying then that would cement that framework, whereas maybe another way to think of it is to use the Hippocratic framework as a firewall to keep people who might not be making decisions based on health or the Hippocratic Oath, but maybe more on capitalism and the bottom line, to keep them out altogether from health and decision making.
They're in already.
Exactly.
So maybe have it spark a paradigm.
Yeah.
Yeah.
I
mean, like maybe we could wake up tomorrow and all be into ethics in medicine. Wouldn't that be great?
Right.
Oh my God. Healthcare for all.
And then,
a right, not a privilege.
Right. That's true. That's true. And then really if an insurance executive were standing by the Hippocratic Oath and then, you couldn't say no based on dollars because somebody, was waiting for some expensive cancer treatment.
Yeah, because you're supposed to do no harm.
And then you're out of a job. I see what you did there.
Boo-hoo.
I see what you did there. I was trying to go right to that point, but if you expanded the Hippocratic framework to bring all of these other people in, then the uselessness or the not the uselessness, but the questionable footing of where they are now would be brought into sharp relief when we'd all go, oh, maybe you shouldn't have anything to say.
Yeah, and things that we see daily that are barriers to care could be questioned and, in my hope, smashed.
Yeah. Okay.
Yeah.
All right. I think we were trying to get to the same place. We were just going different ways. Wow, that's interesting.
Ridiculous little barriers to care. So yeah.
Oh, wow.
I think. What would that do for Del Norte? Oh my God.
What would that do for Del Norte?
What would that access to care? I think would be a big one. Access to financial. Oh, this is hard to explain. Not having financial barriers, not having time barriers, not having subspecialty barriers, not having, it would be just mostly be access to care.
Right, those seem like subsets of access to care. Yeah,
having pharmacies open when you need them open. It would be amazing.
That would, wow, yeah.
I think and I'm not sure that you could do it unless you had actually healthcare for all.
Yeah. Yeah, because
that would have to be a foundational underpinning.
Not just changing the Hippocratic Oath isn't going to change all of that. That would have to be, that's a systemic change. That is a big thing. Wow. Yeah,
and I wouldn't call it the Hippocratic Oath anymore. What we're talking about is more like a health-based ethics code.
But like standardized.
Yeah.
I'm not down with people just writing their own. It kind of means it's not an oath anymore. and you're only beholden to yourself.
But people do that for wedding vows.
Well, yeah, but
Did
the
you
wedding,
write your own wedding vow?
Yeah, and the institution of wedding only. I'm not up there speaking as part of every groom ever. I'm up there talking them in this one instance for that. Yeah. But as if you're taking a place in a or a position in a as a healthcare, as a doctor, as a physician, you're taking part in a larger context that isn't just you and your spouse. Right. It is you and everybody else, and we all have agreed to act along in this certain framework like that. So I'm not down with people writing their own Hippocratic Oath.
Yeah, but
I'd be like the president writing his own oath for being sworn into office.
Is there a problem with that?
Yeah. There are very specific constitutional things you have to say out loud.
I got it. Okay, there's rules for that.
Yeah.
But I think there should be some way to make it a living oath, so that a worldview that's in Tuskegee in the early 30s is not the worldview that we should be living by today.
Okay, well then this begs the question: how many of the people involved, say in Tuskegee and all of that, had already taken their Hippocratic Oath?
Probably all of them, but I don't know which oath they took.
What's that say about the oath and the efficacy of oaths like that then? Did the Nazi doctors take the Hippocratic Oath?
Probably did. So what that says to me is there should be consequences if you aren't held to, you have to be held to it.
Wow.
Right. But not necessarily, I was going to say not necessarily the patients. Yeah, by the patients.
Patients, yeah.
But in an understanding kind of way, because we get it thrown at us in a frustrated kind of way.
Right.
Yeah, so.
Wow.
Yeah.
I don't know. So basically, are you talking about replacing the whole dynamic of, say, malpractice with something more like maybe less monetarily punishmental, punitive?
Yeah, we could have like this
ethics kind of thing.
This emperor, and you could hear the case, and it's either thumbs up or
rip the
thumbs down.
stethoscope off the doctor, drum him out of the core, kind of thing. Maybe I don't know.
Yeah, I don't know.
Wow, I guess this is also part of how a society devolves down to. Just this discussion that we're having, how a society devolves down to the dollar being the lowest common denominator for so much of our public discourse. It would be very difficult to provide some sort of ethical framework in a nation of 350 million people in a modern world that everybody could adhere to or would adhere to or wouldn't spend their time just arguing about.
Right.
It just seems like
I don't think it's doable.
I don't think it's doable either. And
but a girl can dream,
Sure, but what happens is in that kind of lack of an ethical framework, we all just come down to, you get your butt sued, get your malpractice insurance. It's all dollars. It's all dollar bills. It's like that's the common denominator for our public discourse because we have such a hard time finding those other common denominators that might be more abstract or more subjective.
Right. So take it out of the realm of capitalism.
Yeah.
Yeah.
God, and just now I'm left with, is that even possible?
I don't think so.
Oh, man.
Not now.
Oh, gosh.
But it's interesting. You can really jump off. It sounded like a boring topic to me, and then the more I thought about it, I was like, whoa.
Yeah.
It is a big deal.
Wow.
It's a huge big deal.
And this is interesting because typically I feel like we've solved a problem by the end of a health matters.
We just
this time I don't
can of worms.
Yeah, I don't think so. I don't think we've solved anything. It's like, oh my God.
But I can say I personally, as a PA, would like to have had an oath.
Mm-hmm.
I kind of slipped in and missed my whole graduation ceremony, and I had no proof that I actually graduated until I got my diploma a couple of months later.
You had to sit and wait for it.
That's my usual MO with graduations, and it would have been nice to have that. Personally, to have that meaningful moment.
Do you think it would have changed anything for you over the course of your career? Of course.
No.
Yeah.
But I'm kind of jealous of the doctors that they really take it seriously.
There is a gravitas to a 2,000-year-old oath.
Yeah. Yeah, they really take it seriously. And almost every conversation winds up with, well, you should probably first do no harm.
Wow.
It always comes back to that.
Mm-hmm. Mm-hmm.
So... interesting.
I'm going to rest of the day. I'll be trying to think about this now. I'll be thinking about what would be a framework you could write. What would be something you could write that would be specific enough to mean something and still universal enough to be applicable,
and also flexible enough to change with time.
Mm-hmm.
because this is like folklore. This is a story that changes a little bit for everybody, as it goes through time.
Wow. Well, and it is super interesting just to see how the oath has changed and diversified and been revised as well. So, okay. Well, there, look at that. That was an interesting topic. Thank you very much.
Yeah, I thought so.
Any idea next week?
Peripheral artery disease has been calling to me.
What?
Like it does to one. And
what's been calling to you?
Peripheral artery disease peripheral vascular disease.
All right.
Because we have some good resources, and I think they deserve to be talked about. And
wonderful.
It's also an overlooked thing here.
I got some kind of numb things. Should we talk about it?
Like numb things?
I got some numb things on the extremities I need to be addressed.
Okay.
All right. Lynn Szabo, PA, thank you so very much. And we'll talk next week for the next Health Matters. You usually say bye.
Bye.
Thank you.